cell anemia and its effects. And today I have a current sickle cell patient, Miss Jayana
You can
Joseph,
literally just call me your daughter. It's fine.
and my daughter. And she's going to let us know what it's like living with sickle cell. What kinds of symptoms or crises do you experience most often?
Most of my crises are pain related, so I mostly experience pain crisis. That's normal for a lot of people with sickle cell. I normally have a lot of pain in my back, in my legs, and in my arms, and in my joints. Those are the places that most hurt. Sometimes I can also experience like pneumonia in for my chest, and chest pain and back pain. It's severe. It comes in waves. It's as soon as I start to feel a little better, it gets worse, and then it goes back down, and it comes back up.
Mm-hmm.
There is no period where it doesn't hurt. There is no period where it's peaceful. It's constant pain.
Mm-hmm. Do you feel there are misconceptions about sickle cell in your community?
Yes. A misconception I would just say is just what I said before about people not believing you when you say you're having a crisis or having a sickle cell crisis, or how much pain you say that you're in. Because people with sickle cell, we have different ways of describing pain, and different ways of experiencing pain.
So basically, it's a misconception with people in the community understanding that.
Yes. When I say people in the community, mostly it's people outside the community. It's mostly people who take care of those people inside the community.
Okay. What has been the hardest part emotionally about living with this disease?
It's knowing that there is no face value. There's no end to the pain. There's no end to the suffering. Like when things happen to you, like you break a leg or you get stabbed or something like that, you always know there's going to be an end to the pain. Eventually it's going to end in a week or two or whatever. But when I go through sickle cell crisis, or when people have sickle cell, there is no end to our pain. It's everlasting, ever continuing. So we have to find other ways of finding emotional clarity and emotional resolve in that, because it can be very disheartening when you went through something just horrible just a couple weeks ago, and knowing that it's going to come back.
How do you think awareness in healthcare could improve?
Just understanding. Just doctors understanding their patients and understanding what their patients go through. Because at the same time, I feel like there's a lot of lack of empathy and a lot of lack of trying to understand. Even if you can't, and it's impossible for you to understand, at least try. Because a lot of doctors, they treat you like you're just another patient on their board, another name on a file, and that's it. With this being said, I want to say thank you to everyone, and I pray that a cure will come soon. And thank you for taking the time out to listen and watch this documentary that I am so passionate about. I thank you.